Hello, everyone. Good evening for all of you. Today, we will continue our free revision sessions with the third one related to the KAPS exam for the coming exam, the revision for the coming exam. As usual, I will make all of you mute, and at any time, if you want to ask about anything, please open your mic and ask your question. Okay? And also, at the end of this session, we will open the discussion to discuss anything you want related to this lecture. Let us start with the first question. As usual, we'll discuss the questions and the rationale for the right answer. At which dose does dopamine function as a positive inotropic effect? Dopamine has many doses. Dopamine has many doses, each of them giving a specific function. Which of them will be acting as positive inotropic, and we can use it in congestive heart failure? In a dose of 40 milligram per kilogram per minute, or 40 microgram per kilogram per minute, or 10 to 20 microgram per kilogram per minute, or from 5 to 10 microgram per kilogram per minute. Let us see this table, which is showing us the three types of doses of dopamine. We have three doses. The low dose from 2 to 5 or less than 5 microgram. Okay, less than 5 microgram. This dose will give a diuretic effect. This dose, if given for any patient, it will give diuretic effect. Okay, while in between 5 to 10 microgram, the medium dose, it will give the positive inotropic effect. Okay, while the higher dose, which will be more than 10 microgram, will cause vasoconstriction, which is contraindicated here in the congestive heart failure. So the patient who having congestive heart failure, and we need to give him a dopamine for its heart failure or his heart failure as a positive inotropic effect, the dose should be in between 5 to 10 microgram per kg. Okay. The second question. MP is a patient, 40 years old, has recently been diagnosed with major depression, okay, and was prescribed a medication. Fluoxetine 20 milligrams once daily. And he asks you the optimal response time for his medication. What is your response? As you know, for all antidepressant agents, they need a long time to give the full effect. This time in between 4 to 6 weeks. This is to give this time to give the full effect of the antidepressant. Okay, so that the patient should continue with the drug for a long time, not only for giving the effect, but also for maintenance and prevent the recurrence of the depression. While here for fluoxetine especially, fluoxetine is a long-acting drug. It will take a longer time to give this effect. So let's see the choices and choose the right answer. 2 to 3 weeks, 4 to 6 weeks, 4 to 5 months, or 6 to 8 weeks. Normally, for any other antidepressant, this will be the right answer. While for fluoxetine, it needs longer time due to its long deep half, which can reach about 5 weeks. So that it needs from 6 to 8 weeks to give its full effect. Okay, so 6 to 8 weeks is the right answer for this question. The next one. Quaternary nitrogen is present in. What is the quaternary nitrogen? Firstly, The nitrogen normally connected or bounded to 3 bonds. This is the normal nitrogen. Sometimes nitrogen will bound it to 4 bonds. In this case, it will carry a positive charge, and we call it quaternary nitrogen or quaternary nitrogenous compound. In this case, this compound will be polar. Even it connected to 4 alkyl groups, highly lipophilic, but this positive charge make it polar, make it hydrophilic, make it not pass the blood-brain barrier. Let's see the choices. Tropicamide, ipratropium, pyrazine, dicyclomine. Which of them is a quaternary nitrogen compound? Yes, it is ipratropium. Another example of quaternary nitrogen compound is mustagine. Acetylcholine itself is a quaternary nitrogenous compound. Okay, so those are some examples of a quaternary nitrogenous compound. The tertiary amines, the nitrogen bounded to 3 bonds. The 3 groups are alkyl groups. We call it tertiary amine. While the secondary, the nitrogen bounded to only 2 alkyl groups, while the third would be hydrogen. And the primary, this is the secondary, the primary, the nitrogen bounded to only 1 alkyl group and the other 2 bonds with hydrogen. This is the primary. Of course, the primary less lipophilic or more hydrophilic, while tertiary is the highest lipophilic amines. The next question. What is the intravenous bolus? What is the definition of intravenous bolus? Let us see the choices and choose the right answer in this case. A slow and continuous infusion. Oh, it's not an infusion. So this is a wrong statement. A rapid injection of medication directly into the bloodstream through the intravenous axis is the right answer. Okay? It's not a method of administrating medication through the intramuscular or a technique used to measure the blood pressure. Also, it is a wrong statement. The right answer here is a rapid injection of medication directly into the bloodstream through intravenous axis. I'd like to ask a question here about intravenous injection. Can we inject hypotonic or hypertonic solution through intravenous bolus? Yes or no? Please answer the question.
No.
Any other answer? No.
For some drug, yes.
Yes. The right answer is yes. We can do that. Why? Because the maximum volume of intravenous bolus is 10 milliliter. Only 10 milliliter. In comparison to the total volume of the blood ranging from 4 to 6 liters. Let us make it a 5 liter. So it's a very minute volume. Very minute volume in comparison to the total volume of the blood. So its effect will be very minute and it can be diluted and will not give a harmful effect. While the infusion should not. For intravenous infusion, we cannot inject hypotonic solution completely. You should never inject hypotonic for intravenous infusion. Why? The intravenous infusion volume, yes, the volume is very, very high volume in comparison to the blood volume. The maximum volume of infusion can be 4 liters, so it's equal the volume of the blood. So its effect will be very harmful effect. Hypertonic solution can be injected for specific cases to decrease the intracranial and intraocular pressure. We can inject hypertonic solution also to increase the sodium level if we have a hypo or severe hyponatremia. Okay, so the indications for hypertonic solution as an infusion. We have 3 indications. For severe hyponatremia, but we should take care about the blood volume or the status of the volume of the blood. In case of increased or high intracranial pressure, in order to make a section of the fluids from the brain. Also, high intraocular pressure. We can inject hypertonic solution, like when we inject mannitol. Okay, those are the indications for hypertonic solutions that can be injected as an intravenous infusion, while hypotonic should never be injected at all. Of course, the isotonic is the recommended solution. Let us see the next one. Hyperventilation is a condition that leads to, please pay your attention with me in this question and try to understand this topic very well, because it is coming in the exam with different statements. So you should understand it very well. The acid-base balance of the blood and its effect. Okay, here we have a case of hyperventilation. What is the meaning of hyperventilation? It is an increase in the breathing rate. It is an increase in the breathing rate. Okay, so the increase of the breathing rate, what will happen to the carbon dioxide? The carbon dioxide in this case exhaled. What is the level of carbon dioxide in the blood? Decrease carbon dioxide in the blood. What this means? We have a case of respiratory alkalosis. Okay, the pH of the blood will increase. Okay, so this will lead to respiratory alkalosis, will lead to an increase in the pH of the blood, will lead to decrease in carbon dioxide level in the blood. Let us see the choices and choose the right answer regarding to what we explained. Is it lowered carbon dioxide concentration followed by a rise in the pH? Yes, is a right statement. Let us read the others. High carbon dioxide concentration followed by rise in pH, or lower carbon dioxide concentration followed by lower pH, or lower carbon dioxide concentration. Of course, it will be the first choice. Okay, let us see the next question. Which of the following is not used as a vehicle for injections? Peanut oil, cottonseed oil, corn oil, or theobroma oil? Of course, it will be theobromine oil. Why theobromine oil? It's not a liquid. Theobromine oil is the cocoa butter, which used which is as a base for the suppositories. It is a solid in the room temperature, so we cannot use it as a vehicle for injection. While other oils in those choices are liquid oils, so we can use it as a vehicle for injections. Another one, MP is 35 years old female with diabetes. Currently, she has been diagnosed with urinary tract infection. Which of the following anti-diabetic drugs interact with this co-tremoxazole? As you know, it is a combination between sulfamethoxazole plus trimethoprim, which is the first choice or first line in treatment of UTI. Here we have 4 anti-diabetic agents: metformin, rosiglitazone, glipizide, and canagliflozin. Which of them is the right answer and will interact with the co-tremoxazole? It is glipizide. The concomitant use of glipizide plus co-tremoxazole leads to an enhanced hypoglycemic effect of sulfonylurea. Why? As you know, glipizide is a sulfonylurea, and co-tremoxazole contains sulfamethoxazole. Okay. This sulfamethoxazole is an inhibitor. It will inhibit the metabolism of glipizide, so increasing its effect and increasing its hypoglycemic activity. And both of them lead to an increase of the free concentration of sulfonylurea. Okay, so the right answer is glipizide. The next question. Structure of propylene glycol. What is the structure of the propylene glycol? Okay. The word glycol means two OHs adjacent to each other. OHs. Okay. What is this structure? This is for ethylene glycol. Propylene means we have a propyl group, so 3 carbons. This will be the propylene glycol. Okay, this will be the propylene glycol. In some models of the previous exams, they asked about polyethylene glycol. So what is the answer in this case? This is the ethylene glycol. It is considered as a unit, and we have polymers of this ethylene glycol. So we have a polyethylene glycol. This will be the structure of polyethylene glycol. Okay, let us see the choices. Of course, this is the ethylene glycol. And this is the ethanol. And this is the propylene glycol. So the right answer is the B. Which of the following is the most common metabolizing enzyme for clopidogrel? Clopidogrel metabolized by which cytochrome? Cytochrome 304, 1A2, 2C19, or 2D6? The right answer is 2C19. 2C19. Okay. While 2D6 will metabolize a famous example, which is protein. 3A4 will metabolize most of the drug. It's the most common cytochrome. 1A2,
Theophylline.
ethylene glycol typically presents antifreeze. Okay? It is represent the antifreeze, which oxidize to a toxic metabolite. What is this toxic metabolite? Let us see. Ethylene glycol, this is the structure of ethylene glycol, CH2, as we described previously, OH and OH. When it is oxidized, firstly, is it primary or secondary alcohol? It is primary alcohol. So the oxidation of it will be in two steps. The first step will give an aldehyde, CHO, CHO. Then the second step, the second oxidation step will give the corresponding carboxylic acid, COOH, COOH. What we call this structure called oxalic acid. So the end result of metabolism of ethylene glycol is the formation of oxalic acid, which is a toxic metabolite to the blood. What is the antidote for this oxalic acid?
Mazanil,
Antidote called fomepizole. Okay? Fomepizole. This fomepizole, if present, it will prevent the oxidation of the aldehyde and formation of the oxalic acid. Those patients having toxicity from oxalic acid should take this fomepizole plus another two drugs, two vitamins, B1 and B6. Those vitamins will utilize the oxalic acid and decrease its toxicity. If we don't have fomepizole, what will we use? Can use ethanol instead of fomepizole. What is the role of ethanol? Ethanol will be metabolized by the same enzyme of ethylene glycol. So it will decrease the amount of oxalic acid formed. Okay? So it will help in decrease its toxicity. The next question. A patient weighing 90 kilograms with normal renal function is injected with intravenous drug for 10 hours. Okay? The desired plasma concentration is 22 milligram per deciliter, and the T-half of the drug is 1 hour. And an apparent volume of distribution is 9 liters. What is the rate of infusion for this patient? Here we have a pharmacokinetic calculation problem. In all pharmacokinetic calculation problems, I need from you two things. The first one is knowing the formula that you should use very well. You should know the formula very well. The second thing is adjustment of the units. All units should be similar to each other. Okay? We have three types of units. We have units of weight, units of volume, units of time. So all the unit of weights should be similar to each other. If we use milligrams, so all units of weight should be by milligrams. And also for the volume and for the time before we start the calculation. Here, what we have in this calculation problem. The first is the concentration, the plasma concentration, CP equal 22 milligram per deciliter. The T-half equal 1 hour. So that directly you can calculate the K. K is 0.693 over the T-half. So it will be 0.693 hour minus 1. Okay. The volume of distribution equal 9 liters. We need to calculate the R, rate of infusion. By which unit? Let us see the choices. milligram per hour. This is the unit of the answer. Milligram per hour. What is the formula that we can use in this calculation? Yeah, we have a formula saying that Cp, or plasma concentration, equal R over Vd multiplied by K. Can we use the figures that we have directly or not? Of course not. Why? Because of the units. The units is not adjusted. Let's see which unit. Here, milligram and milligram, there is no problem. Hour and hour, there is no problem. But the problem here in the volume, the deciliter, and here we have a liter. So we should convert this liter into deciliter. It will be 90 deciliter. In this case, we can use the figures directly. So R equal Cp multiplied by Vd multiplied by K. The plasma concentration is 22. The volume of distribution here will be 90, not 9. And the K will be 0.693. If you multiply all of them together, you will get the answer, which is A. Okay? All the following are appropriate for initiating therapy for Parkinson's disease, except. See the answers. Amantadine, entacapone, carbidopa levodopa, pramipexole. All of them, we can start with them. All of them can be used for treating the Parkinson's, except one, which is entacapone. Why entacapone? Entacapone, what is the pharmacological action of it? It is from enzyme inhibitor. Catechol omethyltransferase enzyme inhibitor. Is its role in the Parkinson's. Directly, it is not affecting the Parkinson's itself, but it will help in the enhancement of the action of levodopa. So it should be given with levodopa, in combination with levodopa. Why? Levodopa, when passing the brain barrier, the blood-brain barrier, it can be metabolized by COMT enzyme into inactive metabolite. This is one of the pathways of metabolism of levodopa in the brain. When we use entacapone, it will inhibit this COMT enzyme, so levodopa will increase. And going to what we need. We need the levodopa to convert it into dopamine by the effect of dopa decarboxylase enzyme. Okay, this is the second pathway of levodopa. There is another pathway for levodopa through MAO enzyme, or MAO-B enzyme, monoamine oxidase type B. Also, it will give inactive metabolite. What is the drug that we use to inhibit this MAO-B? Do you know it?
Selaginine.
Yes, selegiline or rasegaline, both are called MAO-B inhibitors. So they inhibit the conversion of levodopa to inactive metabolite and increase the conversion of levodopa into dopamine, and this is what we need. This is the needed pathway in the brain. Another calculation problem here. If the rate of infusion is 750 milligram every 6 hours, and the clearance rate is 8.3 liter per hour, what is the steady state concentration? Again, for pharmacokinetic problems, two things. The first one is the formula. The second thing is the units. What is the formula that we can use here? It's like the previous one, but instead of VD multiplied by K, we can replace it by total clearance. So that the steady state concentration equal rate of infusion over total clearance. Can we divide this 750 over 8.3 directly? No, it will give us a wrong answer. Why? Because the unit of time is not matched. Here, the unit of time every 6 hours, while here every hour. So we should make them match it together. How? 750 milligrams every 6 hours. So every 1 hour, how many milligrams injected or infused? Is 125 milligrams. Okay, now we can divide directly 125 over 8.3 to give us the right answer, which is 15 milligram per liter. Okay, so generally, the pharmacokinetic problems, they are very easy problems. However, they have a long statement, but they are very easy. Just know the formula very well. Just know how can you match the units together. Then you can solve the problem with one step only. What is the apoptosis? What is this expression or this term? Term refers to a programmed cell death. It is a system in our body helping in removal of the dead cells. Otherwise, those dead cells will be a base or a backbone for formation of cancer. So apoptosis is a very important system in our body. It is a programmed cell. Which antidepressant is most sedating? Is it fluoxetine, duloxetine, nortriptyline, or citalopram? What is your opinion here?
Nortriptyline.
Yes, it is nortriptyline. Why nortriptyline? It is a tricyclic antidepressant which have anticholinergic side effects or effects plus antihistaminic effect, which leads to sedation. So it is the most sedating regarding to those choices. Which of the following is not serotonin reuptake inhibitor? SRI. Which is not SRI? Fluoxetine, paroxetine, trazodone, or sertraline? Of course, it is trazodone. It is not SSRI. After exercise, which of the following statement is true? Let us see the choices. Systolic and diastolic remains stable, or systolic increase while diastolic remains stable, diastolic increase while systolic remains stable, or systolic and diastolic increase. For this question, for the exercise and after moderate exercise, the diastolic will remain stable, while the systolic will increase. There is an increase in heart rate, there is an increase in the systolic pressure, but the diastolic will remain stable. Which of the following causes a decrease in the renal calcium level? In the renal calcium clearance, not level, so increasing calcium level, or impairs calcium excretion. So what is the end result here? The excretion of calcium will decrease and the calcium level will increase. Which of the following will lead to that? Hypoparathyroidism, treatment with chlorothiazide, treatment with furosemide, or extracellular fluid expansion. Extracellular fluid volume expansion. Extracellular fluid expansion will lead to will affect mostly the sodium, not calcium. So it is not right answer. Hypoparathyroidism. Hypoparathyroidism, this will lead to low calcium level. So it is not right answer. We have two types of diuretics, thiazide or loop diuretics. The only difference between both in their action is the effect on calcium level. Thiazide will leads to increase calcium reabsorption. So decrease calcium excretion. The calcium level will increase in the blood. While loop diuretics will decrease calcium reabsorption and increase calcium excretion. Okay, so the right answer here is chlorothiazide. Is one of the thiazide diuretics. The next question. Glycoside linkage in cardiac glycoside is ether, ester, amide, or disulfide linkage. Of course, it is ether. Any glycoside formed of sugar part connected to oxygen, and this oxygen connected to alkyl. This is the glycoside. This is the general structure of the glycoside. So this linkage is an ether. For the cardiac glycoside, like digoxin, for example, we have three sugars, three molecules of sugar connected to oxygen in a glycosidic linkage. This oxygen connected to a steroidal ring. This steroidal ring, in the position number 17, there is a lactone ring. This is the structure of digoxin. Okay, sugar part, glycosidic linkage, steroidal ring, and in the position number 17, carbon number 17, there is lactone ring. This lactone ring is responsible for the cardiac activity of the cardiac glycoside. Okay, so any structure like this, directly you can expect that this structure affects the heart, having positive inotropic effect plus antiarrhythmic effect. The last question today. Verapamil metabolism should be considered while taking which drug? Here we are talking, or we are looking for a drug that affecting the metabolism of verapamil, either an inducer or inhibitor. Let us see the choices and then we can choose the right answer. Aprepitant, erbizarsen, carbamazepine, iprapril. Directly here, we can say that carbamazepine is a drug that affects the metabolism of verapamil. Carbamazepine is an inducer or inhibitor?
Inducer.
Inducer, yes. It is an inducer. So, what is the effect of carbamazepine on the level of verapamil? Is it decrease or increase the level of verapamil?
Decrease.
Increase or decrease? Inducer will enhance the metabolism. So the level of metabolism, the level of verapamil decrease. Don't forget this. Inducer having the letter D. So what is the effect on the level of the concomitant drug? Decrease with the letter D. If you remember this point, you will answer any question like this. While inhibitor will increase the level. Okay. Some other statements having the same meaning. Inducer will increase metabolism. Okay. And when it increases the metabolism, the excretion or the clearance of the drug will increase also. So increase clearance. Okay. What else? We can expect another statement. What about the T half of the drug? Does it increase or decreased?
To decrease.
Yes, decrease the T half. Okay. So 2 decrease and 2 increases. If you start with the decrease of the level, you can expect the others. So please just memorize that the inducer decrease. Then you can build up the other statements according to this statement. Okay, inducer will decrease the level of the concomitant drug. So it will decrease its T half and increase the metabolism and increase the clearance. If you opposite all of those, you will get the effect of inhibitor. So inhibitor will increase the level, increase the T half, decrease metabolism, and decrease clearance. Is it clear? By this way, you can expect several interactions with the drugs by an easy way without an effort in memorizing. This was the last question today. Okay. Still, we have another 2 lectures plus another 2 complete revision. Don't miss this revision. It is very important for you for the coming exam. We have another lecture in the coming Thursday discussing several questions from paper 1 and paper 2, plus the most recent recalls, which will be in the coming week. Okay, you can join the full revision by linking or by joining this link, ptech.com course exam offer. Okay, you can join the full revision, which contains the full revision lectures regarding to the exam. Okay, or you can join or contact with me in the WhatsApp number. This is my WhatsApp. Okay. Now we can open the discussion, and if you want to ask anything, you can ask about it. Here we have a question asking what is the answer of question number 2. Let us go back to the question number 2 and see the right answer. Here, the right answer is 6 to 8 weeks. Here we are talking about the fluoxetine. What is the optimal response time for fluoxetine? Generally, for the antidepressant agents, it will take from 4 to 6 weeks. But for fluoxetine, especially because it has a long T-half, it needs more time to give the full response, which will be 6 to 8 weeks. Okay. What else? You have any other question? Question number 4. Question number 4. Yes, this one. Here, the injection, bolus injection. As you know, the bolus injection, the maximum volume of it is 10 milliliter. Okay. Here, we're asking about what is the meaning of intravenous bolus. It is a rapid injection of the medication directly into the bloodstream through the intravenous access. It is the very fast way to give the drug with 100% bioavailability. Another question number 16. Which of the following is not serotonin reuptake inhibitor? The drug that is not SSRI here, the choices, fluoxetine, paroxetine, sertraline, all of them are SSRIs except trazodone is not SSRI. Is there any question? Everything is okay? Okay. So now we can finish this lecture. Of course, the record for this lecture will be available directly when we finish, and you can listen to the record again and again in the website. I'd like to thank you so much for your attendance today. I hope it was useful and easy session for all of you, and hoping all of you having a good luck in your exam. Thank you, and see you in the coming revision in the coming Thursday. Goodbye.